get more out of a trip to the dentist than just a teeth cleaning or a filling. Fox 47's Ann Perret shows us how one local dentist is working with a researcher at MSU to screen patients for diabetes.
Abdel Karim Al-Dasuki died from complications of diabetes.
He began losing one thing after the other. He lost his sight, he became blind, he lost his kidney function, he went into kidney failure.
Complications his son, Dr. Saleh Al-Dasuki, says don't show up until about 10 years of having the disease, which is why he's working to make sure people know their risk of diabetes earlier in their lives, maybe from a trip to the dentist.
About 2/3 of Americans would visit their dentists on an annual basis, but many of them would not visit their doctors.
So the MSU professor teamed up with Holt dentist Dr. Susan Maples, who created a survey that determines a patient's risk for diabetes without having to weigh them.
Is your waist circumference over 35 for women, over 40 for men? Do you consider yourself more than 10% above your ideal body weight? And then there are other more classic signs like tinglings of the hands and feet, inability to heal quickly.
It's also something she can notice in patients with gum disease.
The mouth is a real window to what's going on in the rest of the body.
500 of Dr. Maples' patients filled out the survey and had their blood tested from a finger prick. The results found 19% of them were pre-diabetic.
That's very significant. And mind you, if we do the study on other populations, perhaps we might find maybe higher percentage.
Because the CDC predicts by 2050, 1 in 3 adults will be diabetic, but a quarter of them won't know it. Ann Perret, Fox 47 News.
The screening is not available at all dentist offices, but the doctors are working to expand the study.